Now is my pleasure to introduce Fabien Zoulim for the next presentation about the challenges for HDV testing. Fabien Zoulim is the head of the hepatology department at the University Hospital of Lyon. He is also the head of the viral hepatitis research laboratory at the INSERM here in Lyon. He founded in 2023, this year, the Lyon Hepatology Institute. He served when he was younger in the governing board of the ISO, and is well known everywhere as one of the animating person for HBV cure, and actually coordinates the French NRS HBV cure task force and several international projects around HBV cure. And finally, last but not least, he is one of the co-founders of ICE. Few years ago, we were all there together. And Fabien is now your turn.
Okay, thank you, Massimo. I hope you hear me and that you see the screen. Okay, perfect. So thank you for the introduction. Thank you for the invitation for this webinar on hepatitis delta, which is really important. So I will focus today my presentation on more on the assays for HDV testing, because we've heard about all the issues regarding epidemiology and treatments, but there are still many questions around the assays for testing HDV. So we have HDV RNA assays that are heterogeneous and rely on different methods, and I will go through rapidly on some of the issues regarding the extraction of RNA, on the amplification of methods used for these assays, and the fact that the virus is heterogeneous with several genotypes. All these have impact on the quality of the assays and on the relevance of the assays for HDV RNA monitoring during treatment, for instance. And I will give also a few words on the screening of HDV antibodies that was pointed out very importantly, that we need to screen patients that are positive for HBS. So regarding the HDV RNA assays, we have the issue of the heterogeneity of these assays that are mainly linked, but not only, to HDV genotype heterogeneity. And one of the first interesting study came from the French group in Paris, who tried to analyze the and compare the different assays that were available at that time. So it was 10 years ago, as you can see, across different clinical isolates, clinical genotypes. And you see here as a just a summary on the top panel, you see the different viral loads that you can see across genotypes and across regions. So you see here Africa versus Europe and Asia, where you see that their viral load might be lower, but the issue was on the bottom panel was pointed by these authors that when comparing different assays across different genotypes, for instance, genotype 5, 6, 7, or 8, you could see huge differences across these assays by almost 2 or more logs, depending on the assay. So this is something that is really worrying. So a lot of effort has been done to improve the quality of the assay so that we are less heterogeneous. And important studies from Hanover also showed that it was not only genotypes, HDV genotypes that mattered, but also the way the assay is done. So, for instance, they showed that the automated nucleic acid isolation could lead to a viral load underestimation, and they compared different extraction strategies from manual to automated extraction strategies. So here again, a point of heterogeneity in the assays. Another point is that we really need to use the WHO international standard so that we can have correction factors to compare the results across studies, especially when they are using different assays, as well, since the studies are also very heterogeneous in terms of viral genotypes across the world. An interesting study was done by the group of Pietro Lampertico, where they compared the different commercially available assays, RoboGene, the RoboScreen, and Eurobio assays in patients who were treated with Mircudex. And by comparing these assays in patients undergoing Mircudex therapy, they showed that RoboGene was the most sensitive and reliable assay for HDV RNA quantification. Along that strategy, several groups are trying to develop new assays, and with the development of the new technologies such as the droplet digital PCR, it was an obvious application to go for HDV RNA quantification with ddPCR. And here you see the one example of a study from the Italian group from Torino, where they use a ddPCR assay, their in-house ddPCR assay, and compared it to the RoboGene assay. And you see here what is important to do when you have a new assay is really to compare the assay with what a standard, what we could call a standard assay, and to always use a WHO international standard to compare. And just one example here on their study that they showed on the left-hand side, a comparison between their ddPCR in red, the RoboGene assay in gray, and in blue, in-house classic RT-qPCR assay. And you see that across samples, you can see differences that are quite significant, because here it is a log scale. And the impact might be obviously clinical when we are monitoring patients under antiviral therapy. And you see here that between ddPCR and then RT-PCR, for instance, you see quite significant differences in the evolution of HDV RNA that might impact the clinical management of the patient. So we have to be very careful with this. Thankfully, the major diagnostic companies are working on development of new assays. And you see here a few examples. One here is the Abbott group is developing assays for HDV antibodies and also for HDV RNA to work on their already existing platforms. So there's this is quite interesting. And if Abbott is doing something on Delta, obviously you can imagine that Roche is also doing something on Delta, and they are also doing studies with their assays to work on their fully automated platform, because this will be an important point with the big diagnostic companies, that you can use a fully automated process from extraction to amplification and to obtain the results. And again, I don't want to go through this in details, just to say again that when developing assays, we need to be extremely cautious and go through a very rigorous analysis of the performance of the assay, with probate analysis using studies on linearity and inclusivity for HDV genotypes. So here we see that there are improvements that are upcoming, which is really reassuring because we, as you've seen, we have several drugs that are now in clinical development or available. So we need to have very good assays to monitor our patients. And I will finish with the screening assays. So we clearly need a point-of-care test for HDV screening, because many of the patients or the undiagnosed patients, what we could call new patients, but they are mainly undiagnosed patients. They are mainly migrants or vulnerable patients, and we need rapid point-of-care tests for the diagnosis of Delta virus. And here you see a recent study done by the group of Stefan Urban, developing such a point-of-care test, and it was really, really important to show that you can go for it. And HDV rapid test, and I'm sure we will discuss this in the panel discussion, seems to be extremely well performing, and you see here the the overall process, which is kind of classic test, but it had to be done, and thankfully they did it. So you see here that you can detect HDV antibodies across genotypes, and what is very interesting is that you can detect not only Delta antibodies but also HBs antigens. So it's really suitable for screening of people in highly endemic countries or areas. So in conclusion, we are seeing now an improvement of assays for the monitoring of HDV viremia, which is really critical for a correct diagnosis of chronic hepatitis delta, and obviously for the monitoring of antiviral therapy. So we are now going to have more robust quantitative assays, which is really good. And regarding anti-HDV antibody testing, reflex testing for all HBs carriers is clearly recommended, strongly recommended by these clinical practice guideline. And the point-of-care test for HBs and Delta is really important to be implemented in highly endemic countries. So this will need to have also screening policies and improved awareness among the stakeholders. And with this, I will stop here. Thank you for your attention.